Hello and welcome. In this tutorial, we will guide you through performance of the anal self-swab for cytology examination, also known as the anal pap smear. The purpose of this exam is to collect a sample of cells from the lining of the anal canal. These cells will then be analyzed by an expert pathologist who will look for any abnormalities that may indicate that cancerous or precancerous lesions, called dysplasia, are present. If these abnormal cells are detected, you will be referred for further testing with an expert who can find and treat spots of precancer in your anus. Finding and treating these areas in your anus can prevent the development of cancer. Congratulations! You are taking an important step in saving your bottom. We hope you find this instructional video helpful and the exam easy to perform with little or no discomfort. If this is your first time performing your own anal swab, don't worry. We'll be here to guide you along each step. We will wait for you to perform the various steps of the testing procedure, but if you need extra time, please feel free to hit the pause button. If at any time you feel uncomfortable and do not wish to proceed further, it is okay to stop. A medical professional who performs this test on patients routinely will be able to perform it for you. Now, if you're ready, let's get started. It may help to watch the entire video first, and then perform the steps along with the video the second time around. First off, wash or sanitize your hands with hand sanitizer. Now, let's look at the kit. You should have a pair of gloves, a small cup for water, a soft anal swab, and a specimen container to hold the sample. First, put on the pair of gloves. Next, open the swab from its packaging and pull it out by the shaft at the end that does not have the soft swab. Try not to touch the soft portion of the swab. Moisten the swab in water. It's okay if this is plain tap water. Please do not use any lubricant. If there is lubricant in your anal canal, it may affect the results of the test. Generally, if it has been more than 12 hours since last using anal lubricant, you should be good to go for this test. In the past, you may have performed your own rectal swab to test for certain sexually transmitted infections, like chlamydia or gonorrhea. This test is similar, but there are some differences. This swab only needs to reach the anal canal and does not need to go all the way into the rectum. In prior experiences, you may have felt the anal canal and rectum of yourself or a partner. The anal canal is the first part encountered and is usually felt to be tighter. This is due to layers of muscle that surround the anal canal called the anal sphincter muscles. As you can see, the anal canal is not very long and can vary in length between different people. The rectum is far less tight and is the area where one would feel the prostate or stool. We want you to get the highest quality sample by swabbing in the correct spot. That means entering the anal canal, but not going all the way into the rectum. If you haven't actually entered the anal canal and are only swabbing the skin around the anus, you are not in the right spot. The goal is to place the swab in the anal canal, but not insert so far that it reaches the rectum. A good way to know if you are in the correct spot is the way it feels around the soft portion of the swab. If it feels tight, you are probably in the correct location. If it is not, you may not be in far enough, or you may be in too far. Take some time to familiarize yourself with this anatomy. Feel free to rewind or pause the video. When you are ready, begin by lowering your pants and underwear. It may be helpful to take them off if this gives you greater mobility. Feel free to pause the video. When you are ready, use one hand to push one of your buttocks aside and better expose the anus. For this next part, get into a comfortable position that allows you access to your anus. You can bend over or place one foot atop a small stool or the toilet seat. whatever is most comfortable for you and allows you to expose your anus most easily. Next, take the soft swab and holding it about midway along the shaft, insert it into the anus about 1 to 2 centimeters, or a little more than half an inch. The entire soft portion should be inside the anus, but you won't need to go much farther than that. The area should feel somewhat tight, but not painful. If extreme pain or discomfort are felt, remove the swab and ask a medical professional for help. Next, twirl the swab back and forth between your fingers in both directions for about 15 seconds. Excellent work. Next, gently move the swab along the walls of the anal canal, along the front, the back, the left, and the right parts of the anal canal. Do this for about 10 seconds each. Front, back, left, and right. Very good. Perform a few more final twirls of the swab. Remove the swab from the anus. Excellent work. At this point, open the small specimen cup you were provided. Break off the swab midway along the shaft. There should be a point midway along the shaft where it easily breaks in half. Deposit the soft end of the swab inside the specimen cup and close the cup. Discard the shaft of the swab and your gloves in the special garbage bag. You may now get dressed, and when you are ready, exit the private screening area. Please hand the specimen cup and garbage to staff, and they will direct you to next steps. Congratulations on performing your self-swab for anal cytology. You have taken an important step in anal cancer prevention and in saving your bottom.